this lesson, we're going to take a look at patient education, the responsibilities of the nurse, and the ways that patients learn. So what is the nurse's role in teaching? Well, what we can do really depends on our licensure, and that goes for patient education as well. So for the registered nurse, they do a few things. The first thing they do is something called a needs assessment. So they find out how eager the patient is to learn. We find out where there are gaps in their education. We also evaluate their readiness to learn. The other thing that goes on is they perform the initial patient teaching, and they'll adjust the plan of care as needed. An example of this would be like a new ileostomy for a patient. There are lots of education or opportunities for education here, and that's performed by the RN. The licensed practical nurse, or the LPN, on the other hand, they reinforce the teaching that the registered nurse set up. So they provide ongoing education, they reinforce the teaching, and if they ever recognize that the patient needs new teaching, they'll refer back to the RN for that. So when we start to educate our patients, one thing we often will ask them is, how do you learn best? So we're going to address some learning styles. So there are 4 that we're looking at: auditory, kinesthetic, visual verbal, and visual nonverbal. And these all are just different ways in which a patient learns. So a person or a patient that has an auditory learning style means that they like to listen. They like to just be taught with words. You educate them just by speaking to them. Somebody who's kinesthetic maybe wants to act out their learning. They use their hands. They like to touch models. This is these patients learn through kinesthetic learning. Visual verbal is literally reading. These patients like to learn through pamphlets, through websites. They best learn through reading information versus other methods. Visual nonverbal are people that like to learn using pictures. So they maybe want to see a picture of the eye if they have some visual deficits, or they want to look at pictures and diagrams of kidneys to understand how the kidneys work. This is a better way of learning for them. So when we teach patients, it's really crucial that we identify barriers in their learning. Their barriers can be singular, like they can have just one barrier, or they can have combinations of the ones that we're going to look at here. Here are some examples of barriers to learning. So literacy: can your patient read and or write? Sometimes there are cultural barriers. Sometimes there are language barriers. One thing that's really important is that if you have a patient that speaks a different language than you, you're going to want an interpreter or a translator, because you want to make sure that what you're telling them is appropriate and correct. Sometimes our patients will have visual or hearing deficits, and so we need to make accommodations for those. And then sometimes our patients are just too sick to learn. Sometimes we know that they're not going to be able to pay attention and learn what we're going to teach them. So we need to look for opportunities to come back and reinforce the teaching, or just to educate them for the first time. Once we determine a patient's learning style and we look at barriers, then we'll look at something called an education assessment or a needs assessment. And this is where we identify gaps in their learning. So this we'll actually ask the patient, what do you know about your diagnosis or the prognosis? Do you understand your restrictions? Do you understand the medications? So when we talk about medications, we're also going to look at medication side effects. The other thing we look at, do you understand that there are other therapies available? Do you know when to seek help? Do you know what signs or symptoms you're going to present with, and you need to come back to the hospital? That's an example. The other thing you'll ask them is, what do you think that you need to know? And so that helps us identify what they understand in their illness. And it also gives us the opportunity here to identify any errors or gaps. This needs assessment also allows us to assess their readiness to learn. So we can find out how ready they are. And if we've filled in these gaps and they're still not ready, we can re-educate them. And if not, then they're ready to learn and we can actually teach them what they need to know. So let's talk about ways for improving learning for the patient. We have lots and lots and lots of opportunities for technological uses. So lots of hospitals have cool ways to do this, so utilize it when you can. The other thing is you want to use the patient's learning style. You want to stimulate interest. Adults are very oftentimes feel like, what's in it for me? What do I get out of this education? So you have to figure out ways to stimulate interest, especially with the adults. So make sure that you have something that's going to keep them interested. Consider strengths and limitations. So if they're particularly good at reading, but they can't particularly write well, then figure out how that works and how you can actually help them. The other thing you want to do is help to include the patient's family and support systems in their education, because they can reinforce teaching. And the other thing they can do is encourage the patient. I've seen this lots of times, especially with traumas and patients that are needing to ambulate soon. If they have family that's going to encourage them to get up and walk, it's very, very helpful. So doing these things helps to make sure that your teaching is successful. Now let's look practically at some actual teaching methods. So here are some of the teaching methods that we use. So written or handouts. So these are pamphlets. The important thing that you need to know about pamphlets is that the Joint Commission says they have to be at a 5th grade reading level or below. So what you can do is hand the information to the patient in a written form if this is their preferred style of learning. And what you can do then is find out what they understood and what they don't understand, and then you can help fill in those gaps there. You can also do groups and class discussions. So this is something that happens a lot in the community. You can also demonstrate teaching to your patient. So you can show them how to use a walker or crutches, and then you can watch them and make sure that they understand how to use the device and correct them if they need it. One really cool method that's very, very commonly used is called the teach back method. So what you would do is you would explain the teaching point, and then you would have them turn around and teach it back to you or teach it to somebody else. So see one, do one, teach one. So teach a patient, have them teach you back so that they have a good foundation of what's going on with that teaching point in particular. Nursing concepts that we looked at today are patient education. We're promoting health, and also we're focusing again back on our patient. So let's recap. It's important to understand the roles you have. RNs provide new teaching, and LPNs help to reinforce the teaching from the RNs. Learning style. Every patient is going to learn differently, so be sure you ask and you cater to that learning style. Also, you want to identify barriers early so that you can find ways to get around them, and also to give your patients resources if you need them. Teaching methods. Use multiple teaching methods if you have to. Sometimes it takes a couple of tries to make it work. Remember that you need to teach your patient every shift, every time you see them, and then repeat to reinforce the teaching to make it stick. So that's all for today on patient education. Make sure that you check out the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.